Everyone, this is Aliyah Evangelista from the Asia eHealth Information Network. Welcome to this month's AeHIN Hour, and where we're talking on various topics concerning technology for health and civil registration and vital statistics. And we are broadcasting from the National Telehealth Center from University of the Philippines, Manila. Some few announcements before we start our session. We're using Cisco WebEx in our meeting this afternoon, and if you are encountering problems as you participate, please log out the session and rejoin the room immediately. Your mic will be muted during the meeting, and if you have questions, you can type it in the lower right panel of your screen, which is the chat box. And if you don't see anything on your screen right now, it is because we have not yet uploaded the presentation for you to see. Please be patient as we will be having this later. And if you have questions, click the raise your hand button so you can ask directly our speaker about your question. And on our moderator signal, he can unmute you so you can talk to the speaker and maybe to the moderator to explain more of the session. And after our meeting, please check your email and answer the evaluation form that I will be sending to you right after this meeting. So it's very important for you to check your emails right after this meeting. And also, we will be having a short photo taking session after our speakers talk so that we can document your virtual presence in our AeHIN Hour. So for the meantime, I'm going to upload the files. I will now be turning it over to our moderator for this afternoon, Professor from the Gajah Mada University in Indonesia, and also part of the original 7 people who joined the Asia eHealth Information Network. Please welcome Professor Anis Puwan. Hello, Anis.
Hello, Aliyah. Can you hear me?
Hi. Very well, Sir Anis. So can we just try to have a short introduction via chat?
Okay. Thank you, Aliyah. Yep.
Maybe our participants inside the meeting room would have a short introduction. Just chat your name and your designation or your affiliation so that everyone could see where you came from and what you do as a professional. And Dr. Anis will take care of our session and will introduce our speaker. So can we try chatting our names and our destination in our chat box? So I am Aliyah and I am the AeHIN Secretariat. So I hope that other people in the meeting room will also chat their names and their affiliation. So I see here Dr. Morsaline Klubnang, Professor Chien Tsai, our speaker, Dr. Jakir, Dr. Mean. So, yes, thank you, Dr. Jakir from Bangladesh. So I think we are ready. Dr. Anis, you can go ahead and introduce our speaker for this afternoon.
Okay, thank you, Alia. Good afternoon, everyone. Good afternoon, colleagues from Asia. We are joining the AeHIN virtual session for today, where we will have a lecture from our colleague from Taiwan. Our speaker is Professor Chien Tsai-Liu. He is professor at Graduate Institute of Biomedical Informatics, Taipei Medical University. He received doctoral degree in computer science at University of Pittsburgh, USA, and had a master degree on electrical engineering in Taiwan University of Science and Technology. He has a numerous positions in respected health informatics organizations, including HL7 in Taiwan, and also Taiwan Association for Medical Informatics. He is actually very active on research on electronic health records and also health information standard. Without any further delay, I would like to invite Professor Chien Tsai-Liu to present his topic about electronic health record adoption in Taiwan. Please welcome Professor Liu.
Hello.
Hello.
Hello, everyone. Good afternoon. Can you hear me?
Yes.
Okay, so
Please go ahead.
let's start my presentation now.
Yep.
Okay, so you get my presentation files. Hello. Hello.
Hello, Dr. Chien Tsai. Have you
Yes.
uploaded your presentation?
First I have to upload. Okay. I can upload.
Okay,
No,
so
I
maybe
can't.
I will just have.
You
So
have to
maybe I
send
will
me
just
live.
leave. Okay, I will just share my desktop and share your presentation to everyone.
Yeah.
Okay. So I'm gonna share my
No,
desktop to
I
everyone.
have no privilege.
Can you see the presentation now?
Let me see. Okay, ma'am. Okay, now.
So this is the presentation of Dr. Chien Tsai.
Yes.
Can you try chatting your responses in our chat box if you are seeing the presentation?
Okay.
So, Dr. Chien Tsai, have you seen your presentation on your screen?
Yes.
So there. Okay. So go ahead, Professor.
Yeah. Yeah, hello. Okay, so let me start my presentation. How can I control my slide? What about the next slide? Okay, so because this is the first time I attend this conference, so let me introduce you. Although you may already know where's Taiwan and Taipei, and here you can see the map. Taiwan is on the north of the Philippines and Vietnam, and also far from the Indonesia. But we are all neighbors. Although we have the distant each other, but we are all neighbors. So we are in the northern part of Taiwan. So Taipei is in the northern part. So our university is Taipei Medical University in Taipei. Yes. 我们下一个。Okay. Yes. Yes. You can change the slide. Okay. Here is Taipei Medical University. We have we have 7 colleges. It's a little today in my desktop. Okay, so we have 7 colleges and 13 departments. We also have 16 graduate institutes, including this biomedical institute, and we have 6,000 students in total, and full-time faculty about 500. So you can see from the left-hand side, Taipei 101 is in the very far in the picture, far away from the picture, and in the right-hand side, the lower part is our campus. Okay, next. Okay, so TMU, Taipei Medical University, as a healthcare group, we have 3 hospitals. They are accredited by ACI, and in total, there are about 3,000 beds. Okay, 3,000 beds, and outpatient visit per year is about 3 million. Okay, let me introduce our institute, the Institute of Biomedical Informatics. The program started in 1995. First, we established the Center for Biomedical Informatics. By 1998, we formally established our Graduate Institute of Medical Informatics. This is the first Institute of Medical Informatics in Taiwan and in Asia as well. And in 2000, we established a master program for part-time students for your on-job students, and there are about 15 students, graduate students for the part-time students. And in the 2001, we set up a center for the bioinformatics computing center. So we have a focus and research on biometrics since then. And in 2005, we set up a PhD program. So we have 5 student PhD students, and also we starting from 2009, we receive international PhD students and also master students. So now currently we have about 90 graduate students, 90 graduate students currently. And we have passed EMEA accredited in October. So although the official is not announced, but I think there would be no problem for us to approve by EMEA. Next. Okay, focused on integrating medical knowledge support healthcare services, also provision of quality of education and we are focused on the computer science and students with applied engineering or and our you are interested in Yes. Yes. Okay. And let me understand that also is and and I got my PhD from the University of Computer Science and currently I am the director of the EHRs and I also in charge data open up for the and it this way of hashtag level is so here to NIMS is measurable neural this and that is for and the past years ago started from 2001 I also when the up and and I also have been I was also of the system yeah. Thank you. He loudly can hear well. And then, no, no, it's or just just very
Hello, Professor Chien Tsai. Can you repeat what you have said for the last 5 or 15 seconds? Because your connection is a bit weak and we can't hear you.
so it's too weak. But how can
I
I?
think that is okay now.
Okay, so if I
Okay, can you repeat your slide?
yes, I control my slide.
Okay, okay, I will give
No,
you that.
I can control my slide.
Okay, I will give you the. For now, I am the one who's controlling your slide because it's not
Okay.
uploaded in our WebEx. So I think, can you just repeat for the last your discussion on this slide that we are now seeing?
Say again. I can hear very clear now. Hello,
Can you
Alia?
repeat on? Hello, can you hear me,
Yes.
sir? Can you repeat your discussion on the slide that we are seeing right now? Because we
Yes.
were not able to catch what you've said a while ago.
Okay. So this is slide for my introduction. I already told this, but here I want to emphasize. I want to say something about my research focus So I am interested in the following fields: medical information modeling and sharing, electronic health records and systems, and also health information standards, and disease surveillance and outbreak detection, and clinical study information management systems. So these are my research focuses. And next slide, please. Okay, so let's begin our topic about the EHR, electronic health records in Taiwan. So first, let me introduce our health systems. In Taiwan, we start our HID development and EHR adoption since 1990, so about 20 years ago. And the first milestone we achieved is National Health Insurance Program. So this covered about 23 million people, and actually cover everyone in Taiwan. So this is a very distinguished achievement for in the world, because this is the first we use electronic format for health claims, and also we build up the systems to allow the healthcare providers to send their claims to the Bureau of the National Health Insurance. So you can see, starting from the 2000 until 2000, there were about 100% all the claim data are electronic. Okay, next. So this is very beginning. We use insurance card is paper based. So you can see in the left hand side there are the names and some personal information on the car, and in the back, in the right hand side, there's some records to indicate how many times this patient visited healthcare providers. And next. This because paper-based health card is really convenient for patients, also for the management it's not very good. So starting from 1995, we replaced the paper-based card with smart cards. So these smart cards we have chip over inside the car. It's about 32 kilobytes. And in the left hand side, the smart card is for patients. In the right hand side, the smart card is for the health professionals. So people can use this patient health card to access medical services. And because health professionals also, they need to use their this card to identify themselves. Also, because we will use this card to access the patient's information when they visit them. Next slide, please. This is the setting using smart cards. So this is for the dual card systems, because we have a reader. So in one side, on the top is the patient card, and on the side is health professional cards. So a doctor must use his card and also to see the data information in the patient's card. So we have CPOE, the computer-based order entry system, so that once patient insert their car and health professional doctor insert the car, the CPOE can start to walk uh, to record patient's information and their orders. And next. Okay, this is the infrastructure for the health small house. So on the top, you can see this network, health information network. They are used to connect all healthcare providers and also government authorities. They are used to in the top to connect public agents and also government bodies. And in the below side, this is a network for the national health insurance, including their e-claims. They must use this network to send their e-claims to the IDC, for the data center. And after the e-claim information, the e-claim data sent to the data center, and then the headquarters with the Bureau of National Health Insurance can access this data, and also this data can be contributed to the different national local offices or the branches. There are branches in Taiwan, so each can access their data. So currently, the network, there are VPN, virtual private network, so it's secured. And in recent years, this year, we have budget to expand their bandwidth so that they can send their medical images to the IDC and other information too. Okay, next. Okay, next slide, please. Okay. So before talking about electronic records, I think go back one slide, because go back one, yeah, go back one slide. No, go back. Back. 打一下再打一下 go back one slide. No. Okay. One more. Back one more. Hello. Okay. So before talking about the EHR, there's defines terminology here. Although you are familiar with term, we want to define it again here. Electronic medical record is a collective version of many systems. In one hospital, that means these are integrated information of person in one hospital. There are the information are provided based. The fully integrated means they have maximum to organize the patient patient data in some forms. However, in Taiwan, the electronic medical record in Taiwan, we have some form. So in our law, they define the electronic medical record is a medical record which must be produced and stored by a computer and comply with our law, because the electronic medical record production, government production, management of electronic medical records regulations. This regulation was published in 2009. So there are several articles, but here Article 4 is really important. So they identify EMR must be associated with digital signature of health professionals. That means if it is a document, official document, it must have or must be with digital signatures. If there's no digital signature, this schema cannot be official. It cannot be people use. And also, if a hospital or healthcare providers want to uh, want to adopt EMR, they must make a dedication to the regional or central health authority. So this is two the important part. You cannot say, oh, you cannot claim that you already have EMR. You must comply these two articles. So in Taiwan, the electronic medical record system is next. Okay. Okay, this is based on our mission. So the EMR system, the framework of EMR system, you can see here in the background, we can see EMR system. That means all the EMR can be deposited, can be stored in this depositor in the left-hand side. In the right-hand side, they are all we call the hospital information systems, including the billing, payment system, or radiology system, or PACS, medical image system, and the physician order entry system, and doctor information system, and so on. So they are all connected in the front end of the information hospital information system. So because of the production, I mean they change frequently. So in this case, the MRs, the budgetary cannot synchronize with the front end systems immediately. Usually, they will do this batch mode, in batch mode. That means in at the end of the day or in some time, they sync the front end information with the back end EMR repository so that their information, the content will be consistent. So this is a part of Taiwan's framework of EMR systems. So we have independent EMR storage, EMR repository. And next. Right. Okay. Okay. So now, because we have these regulations, the law allow us to the electronic formats from the text. We use paper-based, and then because we don't have law or don't have regulations to allow healthcare providers to use electronic medical records, so they must print those medical records in the system print out and then pass that to the medical record, paper-based medical record. So we call the cut and paste era. And now, because we have this law, so healthcare providers can keep electronic format only. So they can store those medical records in electronic form. They don't have to write the paper-based again. They don't have to print it out. So now in our hospitals, most of the patient records are paper, electronic form. So there's a very few use paper-based. And next, please. Next. Okay. So what about the electronic health records? So in the HIMSS definition, the electronic health record is a subset of the electronic medical record. So that means they, if you put all the EMRs in different hospitals, if you collect them together, that is a part of the electronic health records. So by this definition, we can see if we want to implement our EHR, we must have our EMR ready and then have our connection or the network ready, and then we can collect the different EMR in different hospitals. We have integrated patient health records. So at this time, patient can go anywhere they can they can have their electronic medical records, no matter no matter where he go to the hospitals. The next. Okay, so in the age about 1995 to 2006, our government launched several trial projects for development of EMR and also the exchange of EMR across the hospital regions. So that means we try to use this trial project to establish some form of the network and some form of the EMRs so that we can send the EMR to the other hospitals, and the other hospital and that hospitals can use your EMR in their healthcare settings. So there are two in this period. We developed the two main infrastructure or main systems for exchanging the EMRs. The first one we call patient-oriented health information system. It's proposed by Taipei Veteran General Hospital in 2003. And the other one we call the EHR exchange through a master index center. So that means that this framework, we have a master index, patient master index center, so that we can look at this index, and then we can go to somewhere indicated by the index and that is their patient records. So that's first to see the patient-oriented health information system. Next, please. So in this architecture, we can see in the top we have a depository server, and also we have a master index there, and we will see the index in the next slide. So in the lower part, each hospital or each medical institute is their gateway to connect this depository center with their hospitals. So we can upload the standard format of EMRs to the center of EMR depository server. So we must have a standard format. At that time, they proposed some of CPA and HR7 SMO format and so on. So you use a standardized format of the EMR and upload the EMR to the depository server so that the client through the network can access their medical records. Next slide, please. This is the client. One of the clients can see the index. So they are in Chinese. But in the left hand side, we can see it's different types of the service index over there. So you can choose one of them and can read and click, and then you can read the patient's record. Next, please. So one of the patient record here shows the laboratory results. So once you get the patient, you can click on them and see their patient results. Okay, next, please. So the other architecture here is we have master index center. So that means in the left-hand side, we have called EHR MIC is master index center. That means this server just store index only, and the medical records are stored in each hospital. So if we want to query the patient's medical record, we can go to the MIC, EHR MIC, and see where is this piece of the medical records, and then we can go to the EMR depository site, because in the index we can easy to locate where is the piece of the EMR, and then we can go there to get EMR. So we can see here we also have electronic signature. All the medical records must be encrypted with signature. And next, please. That is one of the index that they are in Chinese, but we can see the patient and the hospital, the patient visit, and the patient name, and so on, and the date they visit the hospital. And so on. Okay, next. The next, in following, from the 2009 to 2012, we also developed some of the systems. First is the Image Exchange Center. This is for the Department of Health and the Welfare affiliated hospitals. There are about 40 hospitals. They can exchange the images through this network. And following, we initiated a National Health Information Project. So in this project, we have established several standards with Taiwan medical template, and also there are about 500 some templates, and developed about 108 HL7 CDF format. And we also at that time, at that period, we also published EMR regulations and implementation guide, and also revised our medical care act so that the healthcare providers can use the electronic medical records. So after that, we started to exchange our EMR starting from 2010 to 2012. And next, please. So this project called Accelerating Adoption and Exchange of EMR project. So they have several goals. So in the break letter in 2000, for example, 2010, EMR adoption rate set about 20%. That means 100 hospitals. The red means we actually there are more hospitals actually adopted the EMR. So for example, in 2010, there are about 172 hospitals, adopted hospitals, and now in 2013, we have about 350 hospitals. The original goal is about 170. So we already beyond over surpass our setting goals. So now in this year, 2014, 13, we focus on the EMR exchange through the exchange, we call the exchange electronic medical health exchange center, electronic record exchange center. So we call EEG, this exchange center. So this is a network we will see later. So now currently we have about 110 this year where can change the medical records through this network. Next, right, please. Okay, so we summarize the strategy we have used. First, we have a national infrastructure for the national health insurance. We already built this secure infrastructure, and also we have done many trial projects and promotion of EHR. So the healthcare providers, hospitals, and the patients, they are all know about the EHR and what their benefits and what the weaknesses they have to mention. And third, we also established the National EMR Development Committee. This committee will give the government advise them how to develop the EHR. So you will see this organization better. And also establish the EMR Program Coordination Office. Currently, I was principal. I'm the principal investigator. And we also have a very secure national health insurance virtual private network infrastructure. And we establish about 5 standardized electronic medical forms. And we also give the incentive money to the healthcare providers and hospitals for exchange their medical records. Next, please. Next is a part of because this is the committee for the EMR development. So in this committee is about 13 people. So we have 4 working group: clinical working group, patient safety working group, and standard working group, and also evaluation working group. They work together so they can evaluate the project goals. And there is a PMO, the program EMR program coordinator office. So this is a team for supporting our ministry to develop their strategy, also to audit all the audited EHR projects. Now this is the standardized templates for EMR exchange. There are 4: medical image and reports, discharge summary, laboratory blood test reports, and outpatient medication summary. Yes. Okay, okay. Go ahead. Yes. So this is the architecture, the network of our exchange center, national exchange center. So in the middle, in the top middle part, this is we call the index center. So this index contain only patient's information, the minimum patient's information. Contain the patient name and their visit to hospital. So we have the index is created by the health insurance from the health insurance claim data. So that because every hospital must send their e-claim daily to the national health insurance bureau, so that the bureau will send this will summarize the data to form the index. And if the patient or if a patient come to a hospital, that they can ask the physician to use the patient card and the physician card to index to query their medical records. So under the patient consent and the help of help from physician, so they can query their index. Once they have index, they can get this piece of the medical records from the a specific hospital. Okay, go ahead. Yes. So this is the form of the query. Go ahead. Yes. Yes. Okay, next. Okay, so in this mode, we have two kinds of mode. One is provision that upload your medical records and retrieval. So you can ask for your medical records. Go ahead. Next, please. This is a provision mode. That means you upload the medical records to the gateway, and the gateway will generate an index to send to the index center. So in the index center, there's also some information from our national health insurance EHR, so that they can combine these two indexes to form the integrated index, so that patient can easily to find out their patient record in which hospital. And next is a retrieval mode, so they have to go to the index center and go ahead. Next, this viewer from the client side, so the patient record can be retrieved and displayed on the POE, so that patient, the doctor or physician can see this ATC information. And next. So the incentive money for EHR attendance. So this each hospital, it depends on the size and their outpatient number. They can get different amount of the incentive money. So in the left column, in the most left column, that means the patients, the hospital specs, the 20 to 50, for example, in the first column, and the outpatient amounts, for example, in the first column, is 50 to 400 a day. So if they have this scale, they can get 250 50,000 to 2.5 million NT dollars. So it's about 0.1 US dollars. 0.1 million. Yeah. Okay, go ahead. But this year, the incentive money decreased very much. This year is about in the first time this year, first time applicant is about 400,000 NT dollars, and if they can change one type of the standard format, they can get 200,000 more. So you can see in the lower side, you can see that the incentive money goes down and down. For example, in 2013, it's about 400,000, and but in the 2014, it became 350, and in the following year will be 300. So the incentive money goes less and less. And go ahead. Next. So now, because incentive money is temporary incentive to the hospitals or healthcare providers. Now we developed the new applications. They include their business by using those EMRs. And next. So now we just talk about the results. We already talked about it here. So the red number means we already achieved. And the break number means the goal setting. Okay, go ahead. So this last year's the analysis about because in Taiwan there are hospital rankings from medical, the highest rank is the medical center, the lowest district hospitals. So we can see the district hospitals is very big in adoption of EMR because they are clinical and they are also the financial factors. So we can see that in this year we focus on the district to promote district hospitals to adopt EHR. And next. Okay, if you want more information, just go to this website. They are all in Chinese, and but you can, if you have questions or you want some information, I can provide some of you, or you can go to this website and ask your Chinese friend to see this information. So this information is all about our project and also the current status of the EHR adoption in Taiwan. So this is my presentation. Thank you. Oh, last one. Okay, go ahead. One slide. Yeah. Go back one slide. So this is a very interesting picture because this is the first computer. It was given by IBM. But this computer needs a lot of space, and also needs it generated a very heat environment. So we must have the air condition. At that time, we don't have the air condition. So once they install, they complete. It was only 3 hours and then shut down forever. So this is the first computer in Taiwan. They work only 3 hours. So this is a very interesting feature. So I keep this here. This is a milestone of the Taiwan health information. Okay, this is my presentation, and thank you for all. Okay.
Thank you, Professor Liu, for your interesting story about the EMR adoption in Taiwan. Anybody would like to pose question directly to Professor Liu? Professor Liu, you can pose your question by chat or directly if you raise your right hand, and Alia will give opportunity to speak. If not, let me try to ask some first question. Professor Liu,
yes.
In your last 3 slides, you mentioned that there are some challenges, especially in the district hospital and small hospital. Can you explain why the district hospital are having a problem to adopt EMR in Taiwan?
You mean the small hospital?
Yes. Yeah.
Yes, you can see this analysis diagram, right? So
yeah,
medical centers they adopt the EMR as 0.1%, and
yes,
the regional hospitals is
68.
It's also bigger hospital.
Yeah.
And it's up 70% of adoption. But the district hospital, because this hospital is very small, so they don't have much money, and they strive to survive. They struggle for survival. So they don't have IT people. They just buy products from the vendors. So they all the support must from vendors. So that means that they don't have their capability to handle the EHR. So this is why they cannot adopt EHR very quickly. This is the main reason. they don't have IT people. They don't have money. Okay.
Okay. Thank you. So I think this is also the question from Usman. He's also asking about this situation. May I know whether the money incentive for the district hospital will be allocated more due to this situation?
Oh yes. For the district hospital this year, you can see the incentive money goes less and less. But actually, this number is not too bad because they are very small. So although the amount of money is small, but it's also very attractive for them. So currently, there are about 100 hospitals to ask our Department of Health to certify their EMR systems. So currently it's about 115 hospitals to implement the EMRs in this year. So I think this incentive money is quite attractive.
Okay.
Is your answer?
Yes.
That?
Yeah. Okay. Thank you, Professor Liu. Is there anyone who would like to ask a question?
Hello, Prof. Anis. I think Hani from Cairo, Egypt, would like to ask a question directly to our speaker.
Okay.
Okay, please.
Hani, go ahead. Hello, Hani. Hani Farouk from Cairo, Egypt. Hello, Hani. I don't think Hani has a headset with him, but let's go ahead with the question of Hani. Adoption and implementation have slightly different meaning. Any research study for evaluation adoption of EHR?
Okay. So you want to? So this is the question is a difference between the adoption and the evaluation of the job.
Okay. The question is, adoption and implementation have slight different meaning. Are there any research studies for evaluation of EHR done by healthcare providers? Are there
for the evaluation for adoption or evaluation of implementation? Which one?
Yes, Prof. Liu. Do you know any research study for evaluation of EHR adoption among health workers or healthcare providers?
I think I cannot specifically indicate which paper, but I've been read. I've read some paper about evaluation of adoption of EHR. So there are papers on some applications. Some of the International Journal of Medical Informatics, there are some evaluation papers. Also the EMEA, they also publish some kind of this evaluation papers. But I think they are there. Although I couldn't indicate specifically, I think there are quite a lot of papers on the publication list.
Okay, so Professor Anis, go ahead with some questions posted in our chat box from from our friends. Go ahead, Prof. Anis.
Yes, thank you, Alia. Professor Liu, we have also a question from Cindy Babayasi. He would like to ask how much is the total amount from the national budget to promote the national EHR? Do you have any idea?
How much money?
Yes.
Because there are long periods from the 1990 to until now. But,
yeah.
But in these 3 years, I think before is not integrated, but it's since we have launched we call the accelerating adoption of EHR. In the first year, we have two.
Or yes, interesting because it is from several years, so that yeah, no, whether there is also
it's $0.6 billion US dollar. It's about but then now this year is only about we have to convert it into US dollars.
yeah, I think we can.
Million, I think this year is 100 million, and next year US dollars. Next year will be double this amount. These 2 years, the budget become more budget for this adoption promotion. Okay.
Yeah. Yes, I think I'm not here very clearly about the number. I think we can discuss later about the number. I think in email or others. And I would like to read other questions from Usman. He would like to ask: is there any target from Taiwan to achieve a full EHR adoption, both for a hospital and clinic? When it will be? Yes. Is Taiwan having a target for full adoption of EHR in Taiwan, either for hospital and also small clinic?
So what do you really mean the full adoption? Because currently we have only 5 standard form of EMR for exchange. So EMR is if you mean EMR for adoption EMR, this is possible because there are many hospitals in Taiwan that are fully use EMR. But talk about EHR because they have to access the EMR in other hospitals. They are very few. So only I indicated the new application. We have several hospitals and the clinics together to form meant for use, especially in the chronic care aspect. So they use the EMR between these clinics and the hospitals. They work together, and those patients' records can be exchanged between this group. So, but this year we have 9 groups to implement this kind of application. So is that Usman's question?
Yeah, Usman also would like to ask more detail about EHR with full exchangeable model in Taiwan. So is there already set the target when it will be happen? Full exchangeable EHR, yes.
Very hard to answer. You know.
Yeah.
It depends on the financial condition and also it's not easy to develop the standard form of EMR. So we only have 5 kinds of standardized form, and if you want to fully use those all the electronic formats, a lot of electronic formats in hospital. So it's not easy. We just pick some of the important parts to be standardized. So now we only have 5 types of the standard form, and we still need others to there's no schedule to see when it's completed the project. But there's a long way to go.
Okay. Okay. Also a question from Clue. He would like to ask the slide which displaying the number of adoption of hospital EHR adoption by hospital. There are number in red color and also number in black color. It is not very clear about us. Can you explain more about this?
The red number, the red color, the number in red color, it means those hospitals already adopt the EHR or the implement kind of the, but the black color, it means that the goal, the original setting goal. So they already surpassed the goal set. That means we already our goals and began our goals.
So what the percentage mean?
Percentage is the original goal. It's 10%. For example, 10% hospitals must adopt EMR. In our goal, we set this percentage. That means it corresponds to the 100 because in the first quarter in 2010, you can see the red number is 172, right? The red one is 100. The 100 is the percentage of the hospital, the setting goal. That means that they are goal already the original setting goal. Actually, there are 172 hospitals adopted that is over the setting.
Over the target. Yeah. Oh, I see. Okay, understood. Is it clear to respond your question, Clue? Okay. And then Dr. Masud, would you like to pose your question?
Hello. Ask the question.
Yes,
hello.
Please.
Yeah.
Yes, please.
Yeah. Thank you for your nice presentation. I would like to know that this model is cost effective. Do you test it, and what is the coverage of this EHR program?
Could you say again?
Yeah.
Yes. Could you say the question again?
Yeah, sure. Your model is cost effective, and did you test it, or you will test in future? That's my first question. And second question is, what the coverage of the people that is covered by this EHR program for your EHR program?
You mean the number of patients?
Yeah.
The patient, we don't have numbers about the patients,
but we have
numbers about hospitals or healthcare providers. We don't have patient number. The healthcare providers or hospitals in our results, right? We have a site shows the results. In 2013,
hello, Dr. Liu.
350 hospitals already adopted EMR systems in the use.
Okay, yeah.
And so,
Okay, yeah. Thank you very much.
Okay, thank you for everybody who joined the session. I give
one more.
Okay, you please.
Yes,
okay.
Can you also ask the challenges, right?
Yeah.
The challenges is currently we have two. The major challenge is the incentive money. If we carers, we don't have enough carers for healthcare providers. But try to transfer their application. They actually use this EMR systems or EMR for their patient care. And the other way, because we have called health insurance, national health insurance program. This is only we have only company to issue this insurance. So we have the only single, because we got a single insurance company. So we want to use that company to push hospital to develop their EMR, so that because they give money to the hospital and they support them to push them to adopt EMR. And the other one is the IT, the information technology department, because in small hospitals they don't have enough people to support their adoption. And in Taiwan, the vendor, the IT vendor, they also have to support many hospitals, so that sometimes if they don't have enough money, their support become very weak. So this is two major problems we face now. Okay.
Okay, so thank you, Professor Liu. I think to issues about incentive and also the IT infrastructure, especially in the small clinic or district hospital. Thank you for everybody who have joined this interesting session, and I give this session to Alia to continue to wrap up and finish.
Okay, thank you very much, Professor Amis and Professor Liu, for a wonderful session about EHR adoption in Taiwan. So we learned about the challenges and other things on the status of EHR in Taiwan, and I hope that you have learned a lot from them. So before we end up our session, I hope you have your video cams with you, so we could wrap up and have a photo taking session before we leave. So could you open your webcam with you?
Okay. Now you work. So in some of the participants are here. Okay.但是怎么听不到？听得到吗？我听不到。他有讲话吗？那个不讲了，我真的听不到。哦，
Ba
no
naman
voice.
yan?
对，打到我把它关掉。OK，这样可以吗？关掉呢？关掉怎么办？没有关掉。OK，
Ano ba yan?
你刚才讲说 no voice， can't hear。No， 没有 OK， 不行。在哪边呢？没有。对。对。Hello， Ali。
So I think I don't see the cameras or other.
Yes, I turn on the camera. Did you see me? Can you see me?
I think we have a little problem in our connection. Anyway, thank you very much. So please check your email so that I could send to you other resources for our AeHIN Hour. This is Alia Evangelista. See you on December 11th for our next AeHIN Hour. Bye-bye.
Bye.
Bye-bye.